Good morning, good afternoon. Welcome to the webinar organized by the International Step-by-Step Association in collaboration with the Center for Child's Health. We are looking very much forward to have you with us in a discussion that will focus primarily on fathers' involvement in child development and care. What does it mean, and how actually concepts that are related to fathers' engagement can inform the development of indicators that may influence policy and program development. It might sound very technical, but the discussion will not be that technical. Actually, we will try to see how we can connect practice, research, and policy in the discussion of how we can actually influence what happens in everyday life and impacts child development. Can we bring father closer to sharing the responsibilities with mothers? Or if they are already committed to that, how the context in which they are living, families, can actually be enabling for such type of practices to be spread in our societies. Well, I will say more about our discussion in a few minutes after I will invite you kindly to follow a small video that talks about father involvement. The video is free to be shared by any of you participating in the webinar today, but also by anybody who's interested in promoting the concept of father involvement. The webinar is organized under a project, but we see projects as means for achieving our goals. The project that supports our efforts towards the common objective that we have is 4EParent. It is supported by European Commission. 4EParent stays for equal, engaged, early, and empathetic parenting, and especially fathers. So I will ask my colleagues, if possible, to already start rolling the video, and I invite all of you to sit comfortably, take a sip of a coffee or tea, and let us know if you really enjoyed watching it.
My dad's journey.
I remember the last few weeks before you arrived. I couldn't wait to meet you. But it was stressful too. I felt like I underestimated every job. It felt like there was always something to do and never enough time to do it.
When Mom felt happy and relaxed, I felt safe and happy, Dad.
The world is tough sometimes. When you came into our lives, I could feel how important it was that your mum and I were there supporting you and each other.
Even when things were scary, I knew you both loved me and you would keep me safe.
I tried to make as much time for us as I could. The moments I spent with you were the best parts of my day. I wish we had more time together.
I always remember the adventures we have been on together.
I felt a bit silly, but I told the stories and sang the songs anyway. I wish I were a bit better at that type of thing.
You and Mom were my favorite storytellers, my favorite singers.
It seemed like every day you would learn to do something new. It was scary, but watching you grow up made me so happy.
With you, I wasn't scared to try new stuff.
We had to go back to work. You had to go to daycare. It was hard to leave you there. I wished I could explain to you why we had to do it.
I made new friends and played with new toys. And I was always so happy to see you pick me up.
I used to tell you stories. Now you tell them to me. I used to sing to you. Now you sing to me. I'm so proud of all the amazing things you can do now.
Just like you shared with me, I want to do the same thing for you.
Family is a team where every member plays a crucial role. From the inception of their life, children have the right to be nurtured, protected, adequately engaged, and supported by their parents. Fathers, like mothers, are equally valuable in parenting and have the right to be there for their children from the very beginning.
And again, thank you very much for our colleagues that worked on this from Eurochild and our organization, International Step-by-Step Association. And we are glad to share this public good with all of you. As I said, feel free to use it in your programs and in sensitizing other people to the topic, as we really believe that this is something that can encourage perhaps more reflection on how much are we really doing to support equal sharing of responsibility in child caregiving. Please share your thoughts on the chat. We are very happy to receive any reflections after having watched that. Now, as I was saying, I'm going to introduce you briefly to what's the plan for today. We are having 2 hours ahead of us. We hope they will be enjoyable because it's more of a discussion rather than, as I said, a compilation of presentations today. We are having, after the brief introduction, we will have a very brief presentation from Giorgio Tamburlini that will talk about a proposed set of policy and outcome indicators that are referring to fathers' involvement in young child's care. And this is from where the discussion actually will start and will involve all the other colleagues that will be part of a panel. The questions that we are planning to answer, and you will also be invited to answer using the chat box or even put questions, additional questions and reflections. What type of data regarding man engagement is collected or is not collected at the country or the regional or the global level or at the service level? And to what extent this is focusing on young age of children? It can be around father involvement, but not necessarily related to child's care or young child's care. Another question that we will explore in our panel discussion and with you, what can be learned from the existing data that is collected from program or service or country, regional, global level regarding father or men engagement in child's development and care, which can inform the formulation of indicators for policy influencing. Is that type of data effective for policy influencing or not? To what extent such a set of indicators can be useful for guiding the development of programs? Because otherwise, like indicators for what could be used, okay, it could be used for program development or monitoring or for influencing the policy development or the policy implementation. So can such a set of indicators be useful? And the last question, as we will propose a set of indicators, and it's not an exhaustive list of indicators, what other indicators you would consider to be useful to be monitored through various services that are targeting parents or fathers to inform policies and practices so that we actually achieve what we are talking was the topic of the discussions today and the programs and policies we are talking about, fathers' engagement and participation in child's care. So this is the plan, and then we will have very briefly concluding remarks. During the webinar, as the discussion will unfold around the 4 questions, feel free to share your reflections or to add information, share resources, or put your questions in the either Q&A or chat, wherever you feel comfortable. Next slide, please. As I said, we are going to have a very interesting panel discussion, and for that, we are having today with us esteemed experts and colleagues. Giorgio Tamburlini, chairperson at the Center for Child Health in Trieste, Italy. You can wave, Giorgio, everybody can see you. Clara Aleman, director of programs at Equimundo. You will hear more about what Equimundo does on this topic, and perhaps some of you might already have heard of their reports. Suna Hano-Spine, unfortunately, she's not with us, but she's been very kind of pre-recording a video, and we will share at the appropriate time her intervention. We have also Jan Peters, senior advisor at the Center of Innovation in Early Years in Ghent, Belgium. Hi, Jan. And Eberhard Schäfer, I hope I'm pronouncing it correctly, founder and senior counselor and therapist at Berlin Fathers Center in Germany. We also have a discussant this time coming from Italy, University of Turin, professor of sociology, Manuela Naldini. A warm welcome to each of you. All our experts are coming from different walks of professional life and institution-wise. So I think it will be a very rich discussion because it will bring together perspectives and expertise that comes from practice, from research, policy, or a combination of them. And I'm very sure that also in audience we have a very interesting mix of expertise and experience on the topic. Well, with this, I can just already start with a few remarks at the very beginning. Next slide, please. Why we are talking about engaging men, and perhaps many of you already are familiar with the multiple benefits of having such kind of equal share of responsibility and care responsibilities for young children. And that's a very strong reason, because the multiple benefits that are either at the level of in the pregnancy and birth period on the child, and also on fathers and mothers during the childhood, and for the family, for the couple, for the society at large, are strong enough to convince actually all of those that are working in early childhood services, or those that are developing programs, or those that are developing policies, to take a bit more careful attention on how much fathers are present, or men's involvement in child's development is present in the way that policies and programs are formulated. Can you click a little bit more, Maya? There's a list of benefits, which I'm not going to go through all of them, as I suppose many of you might be familiar with. But that's one of the reasons for which we're strongly committed to promoting fathers' involvement. On the other hand, we just learned that the data that is collected about, in general, related to families, parenting, and specifically parent involvement, it's quite scarce, or because of the lack of interest or insufficient interest onto the topic, there is very little data that is collected, either at the service level, either at the local, national, or global level. That makes us even more convinced that we need to bring the discussion more broadly and to more stakeholders that are involved in early childhood, but not only, on issues related to parenting and issues related to gender equality, which has impact also on the family life and how the responsibilities are distributed among fathers and mothers. As you could have noticed perhaps in the video, we talk about fathers alongside mothers. Well, with that said, I think that it is important to look at what types of services are catering families and what services are catering children, because all of them have the responsibility to create that ecosystem of practices and policies that support fathers' engagement. And we know that we are talking about social norms that are deeply rooted in societies that have different traditions and have different significance, and the level of barriers might be lower or higher in our societies. Well, we are still convinced that while it may be a long journey, there is much that we can do, and that if we are not bringing the topic on the forefront, less progress it would have been done. That's the reason for which we have started also discussing what actually the data is talking, how the data that we can find and is collected is actually following a conceptualization of what means fathers' engagement, what actually would show us that fathers are engaged, are involved. And that we can see across many types of environments, at home or in services and in society in general. Obviously, there are many stakeholders and many actors involved in creating that type of environment. While we are quite sure that those that hold the most responsibility are fathers and mothers equally in the family environment. But that type of data can really show us to what extent there is an awareness of the role that the fathers play, and what categories of behaviors actually where we want to enable or what we want to see in everyday life. That still would not necessarily be, it would be perhaps half of the road that we would have already undergone if this type of data is not then pursued in the way that it can be consolidated in how programs and policies are enticing or incentivizing certain types of behaviors. policy indicators and outcome indicators might be a road to do that. And that's what we start the discussion with. If we want to have more data, if we want to learn more about how programs should be developed, how we could, through specific policies, encourage a different mindset or change the mindset, would that lead to more appropriate environments that values equally the involvement of mothers and fathers in child development? The most important starting point in our discussion is child development, but the benefits, as you could see, are spread across different actors. With this brief introduction, I'm going now to share the scene with Giorgio Tamburlini and invite him to present the proposed, as we said, the proposed set of indicators that would just drive the discussion around what we have learned through already existing research or from already existing programs or from already existing policies that could be indicators that could inform how far we are or what we could actually do to stimulate through the programs and policies an environment that is incentivizing fathers to be more engaged. So Giorgio, I'm passing the word to you to give us an introduction of this proposed set of indicators. Thank you.
Thank you, Michaela, and good morning to everybody, or maybe good afternoon when it applies better. As Michaela said, this is just the first very preliminary proposal to start a discussion and see whether we can develop some tools, in this case, policy and outcome indicators, that can in some way guide and promote and foster our common effort in promoting fathers' engagement in early care of children. Can I have a next slide, please? So it's quite obvious, and I think it belongs to the experience of all of you, that when you start to promote some initiative, action, you need some data, and that's quite obvious. Also, we have observed in several instances that having policy indicators, that is, indicators that show whether some action is taken and how it is taken and where, can help people to understand where they're going and make comparison with others, monitor progress, and eventually benchmarking across countries. I was involved quite a few years ago in the Countdown initiative, and I remember that after the first round of Countdown indicators, which measure, progress, monitor progress in maternal and child health around the globe, we started thinking about having and combining with the traditional outcome indicators, mortality, morbidity, etc., some policy indicators to show whether countries were in fact trying to improve their policy environment, because without an enabling policy environment, outcomes are very difficult to be improved. Let me have next slide, please. So it came to my mind that we could have two clear examples of how policy indicator can be helpful. One is exactly what I have just mentioned, and this is a quote from Cesar Victora, a friend in public health quite known around the globe. And he states here that progress towards MDGs 4 and 5, which are related to maternal and child health, has been very much guided and improved after policy indicators were introduced about I think 15 years ago. Another, let's say, smaller example in a way is the Baby-Friendly Hospital Initiative. I think many of you have been in touch with this initiative, which is about promoting not only breastfeeding, but more generally a nurturing environment around the baby. And there are these 10 steps to successful breastfeeding promotion, and these 10 steps have been very instrumental in promoting action and measuring progress in hospital and maternity hospitals around the world. Let me have next slide, please. So we decided it could be interesting to try to have a discussion about having some indicators and having some policy indicators in particular, how they have been chosen. I mean, the ones we're going to present today. Well, basically through a couple of rationale. The first is that we looked at the evidence showing that specific practices regarding father's early engagement in child care, when implemented, of course, have a positive and direct impact on responsive fatherhood or indirectly on child health development. So we looked for this evidence, and based on the evidence we have, we can identify some of these practices which regard, of course, the work of professionals in various sectors. The second is, of course, the fact that in order to have indicators, we need to have reliable sources of information, which is usually the more difficult part of this. And combining these two, we came to, I say again and stress that the fact that this is a very preliminary proposal, and we can start to give a look to this proposal. May I have the next slide, please? We are looking, as Michaela said just a few minutes ago, that we have different sectors involved. This is typically cross-sector initiative. Of course, we have the health services, and health services are related to father's engagement from pregnancy to postnatal and then to the first years of life. And then we have the early education services. We have home practices. Home practices related to nurturing care, what we are now comprising in this definition of nurturing care, which is the care that fosters development and a responsive relationship with caregivers. And then, of course, we may have official statistical surveys, data monitoring system that already or in the future may include indicators that show to which extent fathers are involved in different times and different dimensions of care of the child. So now I will show you the tables. I think there are just 3, so we didn't exceed in our proposal. These are just examples. Can I have the first slide, please? So we have on the left, we have the key periods and the settings. So we have pregnancy, birth, postpartum, but then in the following table, other periods and settings. We have the key content, what the indicators is related to, what kind of practice. And then we have a initial definition of the policy indicator, then the outcome, which is very basically the proportion of fathers that are engaged in that particular practice. And then there is a first indication of what could be the source of data which of course may differ from country to country and also from level, which can be local health authority or nation, etc. So we have an example. The first indicator is to which extent the health authorities ensure that fathers are invited to attend the ultrasound, which is the first moment where fathers are involved with a great deal of emotion, I can add, and with a great deal of co-participation with the mother in seeing the child. So this we have some evidence, and we will I will come back to the reference specific that indicates father involvement in U.S. ultrasound contributes to later fathers' engagement in childcare and responsive fatherhood. Same thing we can say about participation to prenatal classes. And when I talk about prenatal classes, I refer to classes that, by talking about parenthood, parenting, and the baby and the development of the baby, are open to fathers as well, and not just to mothers. So we are interested to know to which extent fathers are, these kind of contents are proposed, to which extent fathers are invited to attend, and of course, ultimately, what is proportion of fathers that actually attend these prenatal classes. Then we have, of course, birth, and we all know about how much and how important is what happens at birth, whether the father is there first, whether the father is engaged, whether the father is proposed to hold the baby, possibly skin to skin. And so the policy indicator in this case is whether health authorities and maternity hospital allow fathers to be there, encourage fathers to take an active role, and whether professionals involved, like doctors, midwives, nurses, are actually trained in encouraging and accompanying fathers in being involved in this very early care. And of course, the service records can provide us the data, whether the father was there, whether was engaged in some specific practice. Can I have next? So we go on. In well-child visits, the well-child visit, every country has a sort of agenda about well-child visit at different ages. These are commonly distributed along the first 2 or 3 years in the various numbers from 6 to more than 10. And of course, fathers should attend and be there, not only at the first well-child visit, but even at the subsequent visits. So again, the policy indicator would be about health authorities actually promoting the participation of fathers, whether these professionals invite formally the fathers, and of course the outcome would be the percentage of fathers participating. We have, for example, in Italy already some evidence and data about how many fathers participate to the first well-child visit and so on. Same thing about immunizations. You know that immunization are not just doing the shot in the bottom or in the shoulder of the baby, but it's something more, because there is some waiting area, there is some information given, then the parents have to wait for 20 minutes after the shot. So there is plenty of time for engaging mothers and fathers, not only on basic information about the vaccination and possible side effects and what they should do and not do, but something about how the child develops and so on. So this is another of these crucial times for engaging parents, but within the parents, the fathers. And then the final table is about daycare. In daycare, we have pointed to two specific activities. The first is the so-called roll-in of the new baby entering, participating to the daycare. And usually parents are invited to stay there for some hours, for some days, for a couple of weeks. And of course, we are interested to have fathers also, not only mothers, participating in these crucial aspects that are so important, because they represent the first, usually the first period of separation of the baby from the family. And then, of course, teachers and educators are usually offering meetings with parents, and so we are interested to involve the fathers in these meetings, and we are interested that fathers are specifically invited, and that also timetables are arranged in a way that parents can effectively participate, and fathers as well. Then I come to a slightly more difficult and vast area, which is what happens in the home. You can easily understand that it is more difficult to record what happens in the home. And if you do it through surveys, questionnaires, indirectly, unless you have a home visiting program. Because if you have a home visiting program, then the nurse or the health visitor can effectively observe more directly what happens, or whether the context, the setting is enabling. We have just chosen a couple of activities. The first is the shared reading, which is very important, as you know, with fathers involved, and the second is playful interactions. So these are the most common activities that are suggested. And in many countries, we have some data from survey indicating to which extent parents in general are involved. We usually don't have data specifically regarding fathers, but you should start to have those. Whether the mother is reading, the father is reading, both are reading, etc. And so that is the final aspect that we are listing here is, of course, to which extent national statistics and surveys, which all countries have, do reflect some aspects of early fathers' involvement, and that's something that we should also promote. We should promote the fact that national statistics and census should collect this information. Of course, underlying all this, there is the very basic concept that people usually are more keen to do something if something is measured. And if something if these measures, these numbers are public, whether there is some kind of benchmarking across services at local level, across countries, and across also professions. Finally, I think that my last slide is just indicating oh, yes, I have the references. Just to give an example, the first four, for example, I think most of you are familiar with those. There are review papers or papers analyzing the complex ways in which early engagement can bring benefits for the child, the couple, the fathers as well. And Michaela has mentioned this already. From reference 5 to reference 10, you have papers describing how specific practices For example, as I mentioned before, the participation to the first ultrasound can be transferred in a way in some more further responsiveness and involvement in the early care of the child. There are two possible ways in which we have this evidence collected. The first is whether one practice is bringing more father's involvement, and the second is whether this more father involvement is bringing benefits for the child. So along this theory of change, we have different points where we can have the evidence, of course. Now, I'm sure that we can have a much longer list of references, and this is one thing we have to work on. And of course, we will welcome your input on references that can be give more solid basis to our work. And so this is just to show that we have made some effort to anchor our proposal to some kind of evidence. And finally, just to say, next slide, please, and the last one. So if today's discussion finds that this idea is worth being pursued, I think we can continue to work. There is a working group which is represented here, but of course we can broaden it to many other partners, including all the partners of the 4EParent and naming project, but even broaden it even more to all the different communities, scientific and of practice, that are involved in early fathers engagement. So we will welcome all your comments to this very preliminary suggestion, and see whether there is some way in front of us to work on this and trying to have another tool to promote our programs and policies regarding fathers' involvement. Thank you for your attention.
Thank you also so much, Giorgio. I think that your presentation gave a good taste of where we are heading with the discussion, but also the intention that we have to build a narrative around father engagement. But then there is a more technical narrative, but it's also the narrative that is pertaining to so many context environments, as you were mentioning. A more private one at home, in health services, in education services, in general, in public services, and everything that constitutes actually the tissue, the social tissue of where family is carrying their life. So I think it just provided a very good introduction to our first question. So you've talked about possible indicators, but let's go back and see what kind of data is out there, what kind of data is collected, by whom and where, and how much this data is really looking at young children, because it could be that there are data that refer to fathers in general, but not necessarily related to fathers' involvement in young child's care, as we are actually purposefully discussing today and focusing on, because we are mostly concerned about the children's early age. So to what extent? Because when we talk about childcare, we can talk about childcare up to 18 years of age, and father's involvement at other ages might have different, we might have other expectations. But your indicator, it was very obviously that focused on the early age. So the first question we will discuss now is like, what type of data is collected, and to what extent is focusing on the young age of children? I will invite for this question, and we will have two interventions. Clara will say a few words about the work that Equimundo does, and I think that many people might already know about the work of Equimundo, but I think it's so important to see what's the history also of what Equimundo has done on the topic. And then to move to, we'll have our colleague Suna, as I was saying, with the video pre-recorded. Then we will hear some of the reactions. So Clara, please. I will ask you to mute yourself when you're not speaking. There is some
Can't
noise.
hear you.
Yes. Do you hear me? Clara? She's not hearing us.
Can you hear me
Okay.
now?
Yes, we do.
I took my camera because it says there's an unstable connection. I'm so sorry. So I'll
No
say
worries.
hello. Did you ask the question to me now?
I
Shall
said,
come in?
no, I just gave you the floor in
Okay.
response to the first question. What type of data is collected? And I will just invite you to say a few words about Equimundo and what kind of data Equimundo has been collected in and consolidated over these years, and how it
Wonderful.
evolved actually over the years in terms of reports that Equimundo has developed. So
I'll
the
do that
floor.
and take off my camera just in case the connection goes
Yes.
unstable again. But
Yes.
hopefully the voice will stay.
Mm.
So thank you so much, Mihaela. As you were saying before, yes, there is very extremely limited data typically collected on men's engagement in caregiving of their children in their early years, both at home or concerning child's involvement in health or education services. That's why this initiative proposal by Giorgio and Isa is fantastic in order to help us start shifting practices and culture. There is also very scarce data on parenting, parental support programs, and how they are reaching fathers. We'll be hearing a bit more from Suna of an example of how this is happening in Turkey and in a lot of the countries where we work with our fatherhood programs. And why is that this? Why is this absence of data? It's clearly driven because of the gender norms that you mentioned earlier and practices related to the distribution of work, whereby we know women, and we've been measuring women's participation globally, historically, and still is around 3 times more than men in terms of unpaired care work. So at Equimundo, for those who might not have heard before, we were called Promundo some years ago. We are an applied research organization dedicated to achieving gender equality by transforming restrictive gender norms around masculinities and promoting exactly this: care, empathy, and accountability among boys and men. So promoting men's engagement as caring fathers is one of the pillars of our work. We do believe that true gender equality will only be reached when men are taking on their fair share of childcare and domestic work. I'll try to put my camera on. You tell me if I need to take it off. So now let me share a bit concretely, zooming into the data and what is very relevant about the work we do. In 2011, Equimundo and partners launched Men Care, which is a global fatherhood campaign as an international platform to first advocate globally and collectively for policies that encourage men's equal participation in caregiving and domestic work. And second, to develop and disseminate research and evidence-based program approaches to inform and inspire these necessary changes. So what happened in 2014, 3 years after launching Men Care, Equimundo and partners recognized that there was a clear gap in the research and data and international leadership on the topic of men's full engagement in caregiving. And this was a key missing piece necessary for to move the political and global agenda. So that's how State of the World Fathers reports, next slide, please, Maya, were conceptualized at the time to fill this important gap and to drive targeted advocacy based on data, or at least the existing evidence-based programming that existed at the time. So this became a biannual or biannual publication. It started in 2015. We've been doing one every 2 years. So we have 5 State of the World's Fathers reports by now. And they have become really globally recognized evidence-based advocacy platforms by UN agencies, governments, child rights, ECD, women's rights activists, and many NGOs. And they have emerged as a credible foundational research on the topic of fatherhood and men's engagement in caregiving, presenting not only the state of the field based on secondary data, but more recently we've started to collect primary data, country-based surveys as well, and showing what Giorgio and Michele were saying earlier, how men's positive and full engagement into their children's lives, emotional lives, beyond being financial providers, is in unpaid care, is not only beneficial for their children, for their partners, but for men themselves and for society more broadly. So this publication started to produce and provide a clear way forward. So elevating concrete advocacy asks around parental leave, as well as other policy and protocols for services, like the type of data that Giorgio was showing, if we want to measure those practices changing and those services inviting men and being effective in appealing men's participation, they also need to change the culture, the mindsets of as you were saying. So a lot of changes are necessary in order for us to start seeing differences in the data we collect. And these data from the State of the World Fathers thus started to inform and have inspired a lot of high-level political and civil society advocates to speak out on this issue and to move the agendas on parental leave and father engagement in several countries. Let me show you just some snippets of the reports, and mostly the latest out of dearth of time. So that's the timeline of the 5 reports we've produced starting in 2015, where this was a landmark analysis, secondary analysis on fatherhood and caregiving, making the case of the types of benefits that you were mentioning earlier. In 2017, this became a call to action, and very concretely asking men to do half or 50% of the world's unpaired care work. And when we say unpaired care work, it was about the early years, right? At the beginning, we were measuring fathers and the early years. 2019 State of the World Father focuses on understanding what enabled and what prevented fathers to be more engaged in the caregiving of their children. And we analyzed particularly workplace culture and the factors that were supporting men's engagement or not. And of course, a lot had to do with the existence of parental leave policies, but also with cultures at workplaces that encouraged or not that men took this parental leave if it existed. In 2021, the report focuses not only on looking at the individual behaviors that we would want to encourage from men, but what are the structural barriers to equitable caregiving, and what are some solutions that could be implemented in terms of policies and culture change. Finally, 2023, our last State of the World Fathers, is also very innovative or novel in that we collect data with 17 partners. If we go to the next slide, which was, oh yeah, this I think was the, sorry, the first presentation, but there was, yeah. All right. So let me just continue because I think the other slides might not be there, but if I manage, I can put them up. So the next State of the World Fathers collected data from 17 countries, and this is 12,000 participants, and revealed that thousands of women and men across the world are calling for care to be central in their lives. This means that they want to be much more involved in care. And this time we started measuring care not only in the early years, but care of other dependents in the family. So elderly, disabled, and also to what extent men cared for themselves and men cared for the environment. And what we found is this, that men wanted to be and were willing to become much more involved, and even were willing to sacrifice some career opportunities in order to have more time to care for the children, but this was not possible without a fundamental overhaul of some power structures, policies, and social norms around both paid and paid care work. I don't know if we have the slide, but otherwise, yeah, thank you. In that slide, we can see the 17 countries that participated in the survey, from Argentina, Chile, India, Ireland, Mexico, South Africa, Spain, and many of these countries generated their own national and regional reports, informing at the same time policy dialogues and advocating for parental leave in their countries. So I think I'll stop there and share more in the next conversations about what we learned with this data.
Thank you so much, Clara. I think, again, this was a very good input into seeing that this is what happens at the global level. There has been quite some efforts in the past 10 years, or close to 10 years, on putting up reports that are feeding into the narrative of having fathers, let's say, zoomed into the data collection. Now, let's see a little bit more of what has happened, and then we will have more discussions around how this is reflecting or has impact on the programs, or what can be learned from this data. From the experience in Turkey that Suna will share with us. I think it's extremely interesting to see, first, how a program that has a very long history has been actually responsive to the data that has been collected about the way that the program has had impact, or how the state of fathers in Turkey actually has fed also into their collective reflection on how the program can be improved for better outcomes in terms of behavior change and mindset change, which is a process. It takes time, and we will hear perhaps more from Eberhard on how that happens, or how long it would take, or if it's something that we should perhaps pursue even more. I will ask my colleagues to share what Suna contributed in our discussion with the experience that comes from ACEV in Turkey. Can we push the, yes.
Hello, everyone. It's a great honor to have this opportunity for me to speak at this event. My name is Suna Hanos Penny. I'm here on behalf of ACEV, the Mother Child Education Foundation, and I can share a few slides with you while I'm talking and sharing my remarks in this presentation. So first of all, thank you so much to an esteemed group of panelists who've been playing such a critical role in supporting long-term efforts in changing the narrative around gender transformative parenting and promoting father engagement and gender equal practices. So for those who might be less familiar with ACEV, the Mother Child Education Foundation, since 1993, for the last 30 years, our goal has been to reduce disparities and address inequalities. And we do this all with evidence-based education intervention programs for young children and families. Now, related to our topic, we really see fatherhood as an entry point for democratizing the home environment. In this space, we work so that men and boys can share equally with women and girls, share the care equally. So parental leave for all parents, mothers and fathers is a norm, or where every household has access to quality and affordable early childhood care and education and development. Now, in this regard, we actually recently decided to partner with Equimundo, because there is such limited data available regarding men's engagement at all levels, as my colleagues here have mentioned. Now, the types of data that are collected, both at global level and country level, and even more local levels, are should be covering specific aspects related to fatherhood. They need to look at the caregiving roles and the responsibilities in children's early years. So I have to say, we've been very proud working with our Equimundo colleagues and MenCare colleagues, with whom we share both vision and goals, and also UN Women and UNFPA, who've supported ACEV's program implementation in this space for so long. Now, as Clara has shared, with Equimundo's leadership, collecting the data for the global state of the world's fathers research from Turkey allowed us to be able to really understand what men and women's care meant, caregiving roles looked like in Turkey. Who cares and how do they care? So that we can know how far we have to go with programming. So I'll show you just a few slides to be able to give you some kind of indicators at what we were looking at to be able to then define the dialogue in this space. So one thing we really wanted to understand was how much time do mothers and fathers spend on care activities, and what kind of care activities are we talking about here? So that, because when we say care, immediately one might answer, but when we actually break it down into these way more specific tasks, who cleans the house, who takes care of the children's needs, be it physical, be it emotional, who takes care of the household's food needs, who plans the logistics of family life, or who provides support for the elderly parents or elderly relatives, and etc. And well, one very important data point that we actually found out here was, yes, fathers felt equally responsible for care work. And that was a very good, again, entry point to be able to collaborate with fathers. Though it was important to actually also say that mothers overall are still the ones who are doing the most of the caregiving. Mothers are carrying out more house cleaning, or are carrying out physical childcare, emotional childcare of their children. Mothers are still cooking more and caring for their partner and elderly parents in need. Now, this kind of data is very important and helpful for an organization like ACEV, who's so engaged in program implementation and scaling up fatherhood programming, because it really supports our evidence-based advocacy efforts. This helps to support the rationale for fatherhood programming. It gets our voices amplified thanks to this data. And being part of such a global research, it allows us to compare with other countries and say, wow, Turkey's really low in this category, or we're really behind here. So we need to push this area way more. This kind of argumentation really helps with all kinds of stakeholders, from donors to program implementation partners to national partners and stakeholders. Another specific domain that we were looking for in this quantitative research that was only part of the Turkey research and not the global part was, we really wanted to understand what developmentally supportive parenting looked like for fathers. Because when they said they were supporting their children's development, what did they understand from this? And what was again, how often did they do this? We wanted to understand how often do they give opportunities and provide an environment for their children to play? How often do they read books to their children? How much do they tell fairy tales and stories to their children? Are they able to give and create opportunities to do for the child to do new things? Do they talk about children's emotions, such as fear, sadness, and joy? Do they play games with their children? Now, as I'm going through, I won't read all of them. You'll notice, this is the previous slide, we're always in the rare category. So this was also a very important data point. How much fictional games did they play with their children? How much responsibility were they taking for their children's participation in extracurricular activities, and more. So now this, it was extremely telling, because the gap between women's reporting of hours spent on childcare tasks and the men's reporting of hours spent on childcare tasks were drastically different. And that gap was much larger in Turkey than in other countries. So when we are part of such a global quantitative research, it really provides so much, such a wealth of information to us, and really helps support the advocacy efforts. I'll pause here and later I'll share with you some more data collected, more specifically about the impact of father support programming.
So this was just a brief introduction to what the efforts that have been carried out in Turkey within the larger framework of the World State Father. And I think that was the main point. So if we collect such kind of data, can this kind of data inform the development of certain indicators just by showing where do we sit by having a diagnostic, though the scarcity of data is still out there. So if Equimundo would not collect such data, will we have enough information about how the fathers are performing in the countries? Is there enough interest to learn actually about this topic? I wonder now, I don't know, Manuela, if you want to have any input into the discussion, if anything, in terms of reaction to what has been presented from the country perspective. We've just learned about how the state of fathers have informed the work of ACEV in Turkey. But I wonder to what extent, and there are country reports that have been developed based on the data collected on state of fathers globally. And I do know about some of them that have informed further campaigns at the country level. We are also going to have such kind of reports in the Engaging Men in Nurturing Care initiative. And there will be a report in Italy, and there will be a report in Spain, and in Portugal has already been released this year. So the question is there, where should we look? Is there any data that could actually be collected, or it is collected at country level, and what this data is about?
Okay, I can step in. Thank you very much. It's very interesting what you have presented from Giorgio and the indicator and the outcome. Clara, very interesting, and Suna as well. Really, I appreciate very much your contribution. So I think that in Italy, we have some quantitative data that has been provided mainly by our official statistic that is Istat, but these data are not enough to study or to understand and to give some insights to policies relate to the topic of this discussion today. Because these data that we have, especially at the Italian level, we have this famiglie e soggetti sociali, that is family and social subject, that is done by Istat, is a representative and collected some information, does not provide a specific information on issues that are important in terms of involvement of fatherhood. They are lacking some dimension that I think are crucial. For instance, from also what you have said, I try to say that are lacking information about the use of parental leave and paternity leave, but not only in terms of take-up rate, because, for instance, we have this indicator from the National Previdential Institute, INPS, but in terms of length, for how many days, for how many months father take parental leave. This is very important because it has to do with the role of social policy and the encouragement to the involvement of fathers to care, especially for very young children. That is the topic of this discussion today. So in that respect, we need to work a lot, and we need to do some work. Then I will comment later on probably on the indicator and outcomes presented by Giorgio, but I didn't understand very well why we couldn't posit the dimension of parental leave and paternity leave in that indicator. Probably there is a reason that I don't know. Then I think that what we have at international and national level are data that more often look at the men and women and very few time at father and mothers. And especially when they look at mother and father, they don't focus on one aspect that I think is very important. Some of you were mentioning is transition through fatherhood. So the first time that you become father, and also probably the indicator could be very interesting in collecting this information, because it's that moment that you can be involved and you can understand your career as father and as a mother. So the transition is a crucial dimension, I think. And also in collected data, crucial dimension as transition in the child development, no? That we data are lacking in that respect. For instance, with regard to the end of diapers, the end of breastfeeding, or to the end of the parents' bed and they go in the toddler bed. So when we will collect, if we can have some new survey, would be very interesting also to catching up this dimension of transition. And so with respect to father, would be very interesting to understand first time father and second time father or third time fathers and so on and so forth. There are some dimensions that I think in this discussion can be discussed. And then, of course, we are very much lacking national and international data verifying about friendly workplace practices. So how much the workplace is friendly toward the fathers in having the opportunity to accompany their child to immunization. They can have the permission, they have a paternity leave, how they can share the birth, the pre and after, and how the workplace are friendly on that. I didn't see any dimension about workplace, but are crucial to understand the work condition of fathers, and probably with respect to their mother, or not their mother, their wife or their partner, because the variation in the opportunity to act as a fathers and to be involved has to do also very much with that. Finally, very finally, as a topic on what you were discussing, we see that we don't have data about no-binary parenthood, I mean homosexual parents, what we can learn from those practices, and how has been to some extent taken into account when you think about the set of indicators, the fact that you can have two fathers in your data, from hospital to daycare and so on and so forth. These are some dimensions that I want to share with you. Thank you.
Extremely useful, Manuela. Thank you so much. I think that you made very good points, and I think that's what enriches our discussion and also our conceptualization of a set of indicators. And the additions that you have made are very useful. Actually, we were discussing in our initiative, at least in engaging men in nurturing care, but not only. We do talk about fathers and fathers to be, because I think that it's so important that we tackle also the perspective of becoming a father and being. That's where perhaps we can work. Perhaps I'm saying more easily on the part on building your identity as a father and how it's that envisaged, which is a very personal, individual construction. Yes, so very much appreciated your contributions. Kind of saying that we until we get to indicators, we are still at the phase that we don't actually have enough data. So that we are still not in the place that we have clarity who should collect and what type of data should be collected, so that we can inform specific types of indicators. It's very difficult to have a too long list of indicators, but it's easy to collect data through different types of surveys, right? However, if we were to have such kind of indicators, or if we would have data collected, or the data that is already collected, it differs from country to country, obviously. To what extent actually, and I'm moving now to the question number 2, to what extent, if we would have such data, it really can inform the formulation of indicators? So can this be something that if we would, let's say we have collected all this data with Equimundo, yes, we have a state of fathers report at the country level. can this type of data help us in deciding which indicators should be chosen, or which one should inform the policy development or the program development, or how we can adjust the programs in terms of attention given to fatherhood? Could this be something that can help us understand better what are the barriers, where we should work towards, where are the places, those kind of checkpoints, in our theory of change that can help us stress the work towards behavior change, because that's what we are also looking towards. So the question is, would this be informative enough? The data can be instrumental in making us learn more how to approach the policy change, the program change, and decide on indicators. I will just try to see how we can work around this question with I will start to still with Clara to continue the discussion around the data that is collected, and then I will invite Jan and Eberhard to say what is their view on this.
Thank you, Michaela. If you have the slides, I can continue trying to respond with some of the insights that came from the State of the World Fathers and how they can point to what needs to change in policies, in programs, and practices. So, as I showed before, those 17 countries gave very revealing data and insights about what was the situation of men and care, and as you were saying, what were the barriers, right? So while we were seeing, Suna said it's women in Turkey and women everywhere that are doing 3 times or less more work than men, but still we saw that both women and men across the world are taking care of multiple caregiving responsibilities. Again, not only children in their early years, but elderly, their homes, their neighbors, their friends, extended families. Men say they are doing more, they want to do more, but a lot of barriers to equal sharing. And there, if you press, I think some more things would come out about the barriers, which are, again, structural, normative, in terms of, Manuela was talking about the discouraging work environments, even in communities, financial barriers that make it very difficult for men to become more involved as fathers. And so, despite men taking more caring responsibilities during the pandemic, so positive for policy, knowing that men, yes, of course, this is cultural, they can take up much more care work, particularly in moments of transition, particularly in moments of crisis, such as the pandemic. And also we are seeing that as more countries and companies are putting on like national care plans and including paid parental leave, the data still reveals that too few workplaces are supporting men's care. So again, this is entry point for thinking about indicators and policy. Too few policies and politicians are even considering men's caregiving, while 70% of people interviewed said that this was a priority and that they would like this to be discussed in political platforms by their politicians. Also, that too few boys growing up seeing their fathers taking care, and not only, again, financial provision is part of care, but we are talking about other types of being intimately involved in the daily care of their lives. Next, please. So we this also points, we see, well, this is what we've seen already, that mothers report much more, spending much more daily care in every specific task that is asked. As Suna was saying, it's physical care, it's emotional care, it's all types of taking children to the well care, health visits, to schools. So in all of those, the brown bar are women, as you would have expected. And we see that although it's changing, it's still predominantly done by women. But now what I wanted to point to another insight is the intergenerational patterns that we see and how these influence to what extent men are involved in caregiving. This is for those men that have seen their fathers when they were growing up. So when they were children, they've seen their fathers involved in caregiving and domestic work at home. It's much more likely that they, when they grow up, become more involved in caregiving and domestic work. So this is another point to what type of indicators could we collect about men seeing their fathers, men being involved in caregiving, and interventions and programs that can encourage and provide confidence and skills for men to become more involved in caregiving. Because we know this will pay forward, and the next generation will probably see as naturalized the fact that fathers, that men are involved in both care and domestic work. So this uneven distribution of care that we see could change with some policies that support that. And if we go to the next slide, I wanted to share just some snapshots from, this is something we tried to use an image to represent the road to equal care. And as in this game of snakes and ladders that many of you must have played growing up, we see a lot of progress, but also a lot of setbacks and places where policies and the data shows us that we are not, that we need to do much more work in order to advance in this winding road of care equality. So just some insights and a few snapshots there. If you look below, we see that while 90% of parents, so that's a lot, 90% of parents say that caring for their children is one of the most enjoyable things in their lives. And we see that all those parents that are satisfied with how they are involved in care, they feel much more gratitude and purpose in their lives. Still, most parents talk about the barriers that prevent them from being more involved. 50% approximately of both women and men, more women than men, say that the way they share care at home is a source of stress. And if you look up the ladder, particularly those fathers that are living in very economically restrictive conditions, find it much more stressful and exhausting to take care. So if we are asking fathers to take care of their children, but they don't have the policies, the workplaces, the culture that supports them in doing this, or the childcare service that allows them to do that, it's very difficult to ask them to do this, let alone to enjoy it, right? The reading, the conversations, the types of indicators that Giorgio was, that are so important to measure the kind of the quality relationship that fathers can have with their children through those interactions are very difficult for parents that do not have the support of policies and services. So just to finish, saying that apart from the parental leave policies and the workplace environments, what we've seen is that men's own sense of competency, meaning feeling competent, feeling able, that they can be good fathers, can make an enormous difference in their involvement. And this points us to the programs that we should be putting in place to support fathers feeling more competent as caregivers.
Thank you, Clara. And I have to say, this is an amazing road that you put up here. I think it's, besides being quite creative in the way that the data has been combined with the what it tells us and what it determines in terms of where to look forward to, or what are the setbacks. I just would like to move now the discussion towards more specific, let's say, context, inviting Jan and then Eberhard. Because I know Jan has worked for so many years in the early childhood education and care field, and knows, you know, the ins and outs of it, from policy, research, practice wise in all senses, and also has been strongly involved in the issue related to fatherhood. So I wonder now, coming to you, Jan, how much such type of data can really inform the development. What can such data tell us? What can we do with such type of data? And to what extent it can be useful to use it for developing indicators from a service perspective, but also system perspective for those that are working in early childhood education and care. Giorgio just mentioned a few indicators proposed for daycare. And we know that mothers and fathers interact with early childhood education and care quite frequent. And the earlier, perhaps, the more frequent. So how do you see the use of data, the relevance of such data? Is that such data collected, by the way? Would that be something to look for? Unmute yourself, Jan. Yes.
We have seen very interesting data, and I'm very happy that we now have those data. But I must say that when we see all the data, we have the feeling that there is still a lot of work to do, and I agree with that. But on the other hand, you must see, if you compare the father involvement also in the house with what happened 30, 40 years, 20 years ago, you see that there is a lot of progress. And if you work with fathers, I think it's very complicated if you always refer to what they don't do yet. You know, you have to motivate them. And what we tried is to collect data on the level of the childcare centers or the kindergartens, especially childcare centers, and use then those data to motivate the people who are working in the centers. Because we have once made a film, and it was translated in a lot of languages, also in Italian, in English, in French, and in German. And it was about parents, what parents were thinking about early childhood centers. And we wanted to film in different countries, and we said we need as much fathers as mothers. And all the centers said, no, I don't think we found fathers. And fathers are not interested. And then I said, okay, if you don't find fathers, we are looking for another center to film. So there is really a very negative image of fathers in childcare centers. And of course, it's a very female-dominated world. And women have they are right when they are saying that men are doing not enough. But it has a lot of consequences, and the mothers, but also the childcare workers, they are really gatekeepers, and they can open the door for the fathers, or they can close the door. And what we have done is to ask them to collect data on the level of the institution, and it was, for instance, the intake of the child. How many fathers are coming for the intake? How many mothers are coming? And always asking the difference between not parents, because parents is mostly mothers, but always asking how much fathers are there. The adjustment period. You see that in adjustment periods, in the beginning, in the first weeks, it are mostly mothers who are invited. They talk to the mothers, but they don't ask it personally to the father to be involved in the adjustment period. And then you have, for instance, to bring the child in the morning and to pick it up in the evening. We have seen in a lot of research that it are mostly fathers who are doing that. So that's a positive aspect of an engagement of the fathers. But Ali, it's interesting to have data on the level of the institution so that you can motivate the childcare workers to go towards an opening towards fathers. That I found very important. And then you have group activities. What we have seen is that fathers are much more interested in activities where they can do something, especially do something with their child, than in activities where, like a coffee morning, where they talk among each other. So where the mothers talk about, mothers like that, fathers don't like that. Fathers want to do something. So what we have, I can't show them all, but we have all kind of forms that we ask to, and then every time that the mothers here, the fathers here, and you see there are huge differences in which activities are working very well with mothers and which activities are working very well with fathers. And what we do then afterwards, we ask to the childcare centers, okay, can't you focus maybe more also on activities that are interesting, that are attracting a lot of fathers? Another very important point is the way the rooms, the playroom, the photographs that are on the walls, that are also men on the walls. And of course, very important, but I also worked a long time together with a lot of colleagues from different countries, but it's not easy to change. We need more men to work also in early childhood education, but it's very difficult. Peter Moss, when he was the president of the the child care group in for the European Commission, he asked in 96 that in 2006 that there would work 20% of male workers, which should be 20% of male workers in the centers, and now the highest number in Europe is 12%. So it's not really going forward, and I think that the climate in the centers has to change, but therefore data must motivate people to engage fathers, and that's, I think, is very important. The data on the global level are of course very important because they are important for us, for who are making programs and who are. But I think on the level of the institution, it's not very motivating to saying on a meeting for parents that fathers are working, are doing less than mothers, and so they know it. But it's just a question on how can we change it. We in Belgium here, we made a book 2 years ago, and it was called Father Participation for Dummies. And there was some advices for everybody who is working with fathers, which is important. That is not, if you invite fathers, that you are not saying, please will you come, but that you say, we need you to come to the meeting, because you have to say something on it. So another thing that works very well is when the children can already speak, to ask to the children, will you please invite your father to come to the meeting? That works also very well when their child is doing that. And then another thing is very important is doing things together. So especially with the child. So activities where the father can do something with his child, playing, and so that works very well. So that are all kind of data that we collected and that we use to change the practice on the
exactly.
level of the institution.
And coming further, I think that they can also inform also policies at the level of the service, so that all those that are working in the service actually are embracing the same approach to families. I think that's equally important. Like if it becomes a policy of a service, but that has to be nurtured by clear motivation, strong reasons, strong arguments for that to happen. I'm moving now to Eberhard. I'm also mindful of the time. You work in a father's center in Berlin, and you have a day-to-day contact with fathers and mothers, and in families, couples. So in your work, to what extent this type of data is relevant or not, is helpful or not, or to what extent the work that you're doing actually can contribute to strengthening the data that comes and influences the policies?
Thank you very much. Thank you very much for inviting me to this inspiring seminar. And I was very interested in listening to the presentations so far. And I can only fully support what Jan just said and reported from his practical work in regard to how fathers feel invited, activated, and get the notion that they are seen as caring parents. Let me maybe just add 2 or 3 aspects that I got from the presentations. I fully agree to Clara's first statement. Their change in regard to fathers as carers is coming slowly, and I'm afraid that there are 2 players in that game that are slow in changing. One is fathers, 2 is institutions and professional services, And third is mothers, who are, as Jan said, function in many times as gatekeepers. Will I invite my partner to be a caring father, and will I support him, or will I, or won't I do that? Do I see him more than a supporter or an earner in the old-fashioned way? Maybe I can take one or two examples from the context of my work. Giorgio mentioned, for example, the perinatal services and prenatal classes for the preparation to birth, and are fathers to be in the picture, or are they not? And in Germany, we have a sort of mixture of class forms, designs. Father are part of it or not. They can decide. And beyond that, we should carefully look at what is the curriculum there and what is the outcome. And only as a very rough picture, we can say that from the many existing curriculums and prenatal classes, fathers who participate are more seen as a supporter for their future mother partners than a first caring parent figure. So this has been called one factor of retraditionalization of parental roles. So before couples become parents, they have a mindset and picture of future roles as parents that are seen quite equally. Two carers, two earners, and we mutually support one another in both spheres. And once the baby is born, they quite often move to traditional roles. The father is more seen as the supporter, but mother is seen as the primary caregiver and the first bonding parent. So in other words, from our notion, what should happen, what should be the curriculum in classes that lead to good parenthood, fathers should be much more seen as carers, and they should much more be invited to even take part in them. This is one example. Another would be, Giorgio, you mentioned that in the where can we find indicators? That is also services after birth. You mentioned the well child visits, and from what I know, which is more the German picture and the Berlin picture, maybe the well child visits appointments are made from the services with the mothers, and it is not part of the picture even to think about, will the father be present or not? He might be present, just it might just happen, and even if he is, we still don't know whether he will be addressed and integrated. So in other words, if well child visits are very important for family health and children's health, and it should be not so difficult to make appointments with both parents here, and in this way have fathers valued as the second primary caregiver. And maybe a third example is daycare facilities or childcare facilities. You mentioned the indicator of, will fathers bring their children and pick them up? And I think, yes, this is a very important indicator. But if we think of parents who are separated, and there are many, we have to take in account, and there are even at least 10% of all parents will not be living together as a couple when the baby is born. But after that, when parents are separated, and in Germany, if parents don't have joint custody, the father is not even entitled to talk with professional staff from the daycare facility and give and have exchange information about the child. So this is really a field of action. Something has to be done there, because if I speak with separated fathers in the father center, they quite often report things like that to me.
Yeah.
I was interested to speak with professional staff about issues from my child, and they said, "We are sorry, we are not entitled to do that." So maybe these three give some more to the picture. Thank you very much.
Yeah, I think that, thank you so much, Eberhard. I think that it nuances a lot the discussion that we are having. I mean, the indicators are kind of very cold and sharp and dry, but the reality is very nuanced. And what we have to understand is to what extent the indicators can provide some direction of travel, so that we point to elements of policies and programs that need to be changed or adapted, or look for what they can provide in terms of change. But the reality actually, it's showing us that the complexity of the conditions in which fathers can exercise their roles is very diverse. Culturally, but not only, as you were mentioning. And we can have other peculiar situations, non-binary parents. I mean, there are many other variables that can be taken into consideration. But I would like us to transition, because I think it's a good continuation of the discussion. And I will give the word to Giorgio. As now we are talking, if we were having such set of indicators, how much it would guide the development of programs. And Eberhard was just mentioning to some of the things that could influence the way that we are looking, for example, at programs that are, or courses, I would call them programs that are targeting fathers to be, or in general, new parents, right? But not only. If we are talking about either new parents or the professionals that are interacting with new or already existing or having been already parents. So to what extent really this kind of, you see as effective, such indicator? Effective, yes? So really leading to something. Because otherwise we can have a very nice intellectual exercise, yes, looking at all kinds of literature review and research and even formulate them. Do we think that they can be very operational? Can they really be effective in determining the change that we want to see? Or we must believe in this, that it will take a lot of time, but it will at the very end. Why we should propose, why we should look at indicators as a strong lever that we can put in place. And now, Giorgio, to you.
Yes, an example came to my mind. Couple of weeks ago, while we were already working on this list of indicators, we had a kind of preliminary list. I was involved in a training for a health authority in my region. The training was, let's say, on nurturing care for early childhood. And the participants were all the professionals in the maternity hospitals, midwives, doctors, pediatricians, nurses, and also those involved in the field care, home visitors, pediatricians, family pediatricians, and so on. So there was the whole system represented there, included the educators. Now, I mentioned about these indicators, and the reaction was, if we had those, we could, and if we had our respective authorities, the health authorities on one side and the municipal authorities on the other side, because both are involved in providing these services, that would make immediately a difference. because we would start to measure what we just learned that we should do. Calling the fathers to the well child visits, encouraging the fathers to be active during, childbirth, and so on. I don't want to go on the list. But my impression is that, at least at service level, if you take the governance, let's say, body of the service, if they would adopt these indicators, that would make an immediate difference at service level. And that my impression. Then I have to provide an answer to Manuela, because she was surprised not to see the parental leave, the paternal leave especially. The reasons are two. First, because in the very last item of the list, national statistics and surveys, that was meant to represent all the information that relate to national policies, for example, this one. So parental leave and duration and uptake should go under the very last item. But on the other hand, I would like to stress the fact that this proposal focuses on practices that are immediately, directly linked to the outcome we are considering, which is paternal responsiveness, child development, etc. While paternal leave is indirectly linked with this kind of outcomes. So, I mean, it's a necessary condition, but not sufficient to produce, because what really produces the outcome for the child, but also for the father, the mother, etc., is the quality of involvement, not just being there, not just being free from going to work. So that's something. It is, and there is another point that I would like to make. Of course, we are all aware about the fact that we have homosexual parenting, we have separated parents, and so on. But I think we should start to work on the majority of fathers, because the issue is also there. We cannot forget that the mainstream about fatherhood and child development is coming from the majority of fathers that still have to be involved more than they are now. And services should start adopting this perspective and working concretely towards this objective, and as a consequence start recording data based on some indicators that we feel represent and describe something which is really important for the outcome. So that's my reflection on what we're trying to do. Of course, this is not a complete list. Of course, data can be recorded and collected in different ways in different countries. But if we focus on the service level, which is very important, I think we can also we can already apply some of those as a guide for service for professionals and for authorities that manage these services. And then the national statistic and service also must be, as many of you observed already, must be fed with new information which is relevant for fathers' involvement. And that, I think, we could even divide the indicators at service level and at national statistical level. And on this last item, I would invite others to contribute, because I'm not personally so knowledgeable about this. But I think this is another aspect, another chapter. I would say chapter 1, service level; chapter 2, national level what we would like to have and we don't have yet. And I would invite, I don't know, Manuela, but all of you, because also the state of World Father would be much more relevant and represent based on national statistics, not just on surveys, because surveys by definition are biased, because just the sample is little, because those who respond are not representative of the total sample, and so on. These are my reflections, but as I said before, this is just the first, very preliminary first attempt. And we ask you whether you think this is worth going on. I mean, trying to improve it and maybe frame them differently, as I said, in service level and national level, or something like this, because we need your feedback in order to see whether we have to work more on this.
Thank you, Giorgio. And I will invite now Jan, and then I will invite also Eberhard, and we will have also some contribution from Suna, because she was mentioning that she would want to say a little bit more in terms of data that they collected and how that impacted. That can also lead us to how much the data is really having an impact in the way that the programs are formulated, or what data can help. We are in an advocacy effort here, and also not only advocacy. We really want to see how we can, where are the gatekeepers and how we can influence, or what are the influencing points where we can make a difference in terms of changing mindsets and practices. So as far as I can understand, there have been reference to the service level, but I wonder to what extent, and I think Eberhard also pointed to a certain extent, and Clara also mentioned that we might work with the fathers, we might work with the fathers to be, we might work with the professionals. Would that be still enough? Or the indicators will not necessarily refer to only individual level, we'll look at more institutional level. So what kind of an approach we should actually have into formulating such indicators so that they are effective, not in the ecosystem where families are existing, having their life? I don't know, Jan, what do you think? Please unmute yourself. Yes, we know it happens to all of us.
I think it's very important that we work on what we call to the different levels of the competent system. We say that in early childhood. So, for instance, what we have seen is we did the research on the manuals that are used in initial training, for instance, and then you see that there is really a lot of work to do. If they talk about parents, it's mostly about abuse and it's about violence. There is a very negative image of the fatherhood in a lot of course, it was in Belgium. I don't know if it's in other countries, but there was really a very negative image of fathers in the manuals that were used in the initial training. Another thing is what we call in English not seeing fathers, so that there are not in examples, for instance. So we counted the number, for instance, of images in the manuals, and then we saw that it was only less than 10% were mostly fathers, and 90% were mothers. So there is really still a lot of work to do in the initial training. And what I think is very important is we need to talk about positive fatherhood, and not always refer to abuse, sexual abuse, violence. Okay, that is of course important if it's happened, that you do something with it. But if we talk about mothers, we are not going to talk about negative things, about abuse, about violence, but there is also violence with mothers. So we must do a big effort there. And then what Giorgio also said is, I think it's very important that we train the childcare workers, the teachers in communication. And what we've seen in recent research on gay fathers, for instance, that it's very important. It's sometimes very difficult for women who work in childcare to communicate with the gay fathers. They feel not very comfortable. So that are things that have to be where they have to be trained. And also what we have already heard, and which is also in my country a problem, is divorced fathers. There are a lot of divorced fathers who are not invited to parental meetings. Recently, somebody came to me and said, you imagine they don't even have my address or my telephone number. So they only have that of the mother. And the mother, of course, they have conflict between each other. And in that conflict, the centers have mostly take the position of the woman. And I think they have to be objective. And so that's very important. And then another thing I want to say is research. There was a colleague of me, Tavecchio, a Dutch colleague, who said several times that if you do research, you may not say I do research on parents, because if you do research on parents, it's 95% mothers that you are doing. So you have to be very clear, and you do research on fathers or you do research on mothers. We also see, for instance, if we ask fathers how much time they spend in care at home, and we ask the mothers how much the father is spending care, that you have very different results. So mothers are underestimating the care, and fathers are overestimating the hours they work in care. So it's very important that also the research world is more looking at those indicators and is taking care of it. And then on the governmental level, I think it would be important that they ask data on the number of fathers and mothers that are going to parental meetings. But of course, I'm always a bit scary about it, that not asking too much administration of the centers. It must be kept quite simple, but I think it's important that they have data about the representation on parental meetings. And then I think the government has to have a saying that there is really an obligation to send invitation to all fathers, also divorced fathers, to participate in parental meetings and other things. And then I think also that the government can play a role in that, in a positive image of fatherhood. I think that's quite very, very, very necessary, I think.
Thank you so much, Jan, for your contribution. I think, yes, we all strongly agree, I think, with all the points that you've made. Initial service, initial training, ongoing training, continuous training, research, governance. I mean, it's a system level view that we have to approach, even, particularly when we're talking about how these indicators could be useful, could inform various aspects in the way that the system is supporting, enabling fatherhood. Eberhard, what do you think? Would such indicators be useful?
Yes, they can. Let me just say, I fully subscribe to what Jan just said. It's just my professional experience is just like that. Thank you so much. But coming to your question, yes, of course, data finding, collecting, and presenting is an important part of the game. But maybe I think we have a gap between research, policy making, programs, and practice. And if anyone could fulfill one of my greatest wishes is let us overcome that gap and work together from those different fields and try to differentiate and make it more well, visible and valuable. Just as an example, from my experience, lately in Germany, there was a report on the number of fathers who participate in family centers programs. We have a widespread network in Germany of so-called family centers that are designed for informal and formal learning for the benefit of families. And that report said about 20 years ago, the participation of fathers in those family centers was at some 12 or 13%. And 20 years later, we are at 18%. This indicates change is coming quite slowly. So my wish at that point would be, could there be any action that makes change a little bit faster? They knew 20 years ago, well, 12, 13% is not a lot. What can we do to raise in the participation, the figures, the numbers, more fathers in those programs? This report only reminds us there are things to do. So I wonder, is policy and policy making willing to do that? And after 25 years in this field of practice, I'm a little bit full of doubt.
Skeptical, yes.
Yeah.
Well, I think it's just it stays with us to start pushing harder or stronger, and one of the lever that we can see is using data for that, using evidence, using arguments, strong arguments, and try to convince those that perhaps politicians that are becoming fathers are who can become our strongest allies, who knows. I'm mindful of the time, and it seems that we're a little bit going to go beyond the allocated time frame. Question now more to Manuela, as she's been listening a lot. What are your comments about the usefulness of such indicators? And from the discussions that we have had, what would have been other types of indicators that we should have looked into that can be useful to influence policies? I mean, hopefully, policies and programs.
Okay, thank you very much. It has been really very, very useful and very rich, the discussion. So thank you very much to all. I agree on many aspects that have been raised by Jan and by Herbert and by the others. So thank you very much, really. I think that are very useful, all these indicators, of course, but they need to be a little bit more tested and in some way to articulate better, to include some dimension that, for instance, in the discussion also has emerged. For instance, the importance of separated or divorced fathers is very, very relevant, but could be also relevant to take this dimension into account in terms of indicator, because, for instance, when there is the divorce and separation, at least from the research that I have also conducted in Italy, the father involvement raise or increase very much. The father involvement also with very young children. To this respect, for instance, when we have the indicator about daycare, it would be very interesting to see to what extent the flux of communication about all type of communication is really take into account both parents, mother and father, or parents one and parents two, because in many circumstances the maternal gatekeeping that have been mentioned has to do with that also. No, the educator, they contact only the mother and the father is outside. Or so in that sense, for instance, in Italy, when you have joint custody, for the educators or for the teacher, is compulsory that you communicate all what is going on in any aspect, even in a party, to both parents. And that could help to have more father involved in that. And also, for instance, in having these mother chats. no? The chat of the mother, where all things is going on, is a way of maternal gatekeeping that we have to try to control or to reduce this aspect that I think is also very relevant. I had many other comments, more specific, but our time is really running out, so I don't want to insist too much. Of course, in home, in the area home, I think that we need to include other dimension that has not only to do with the relationship between father and child, but also between father and mothers, to what extent the fathers co-share with the mother many aspects, also very difficult aspect of the care activities or of the daily routine. So in this area, there is a lot of space to improve the kind of things that we need, but of course has to do with the survey, so has to do also with the aspect that it depends from the money, from what already exists, and so on and so forth. I don't have any other things very relevant to share because there have been many important insights, and I think that further on the discussion can go on. And thank you also to Tamburlini for his answer to the paternity and parental leave, though I don't agree completely.
Well, let us disagree. I think that's from where the good discussions actually are born. I thank you also very much, Manuela, for the insights. I think that we can have perhaps a 4-hour discussion, or every day we can have discussions around the topic, as there could be so many things to share. I think just linking also to what Clara was putting in the chat, I don't know if you have had a chance to look at, but I think, and I think in our discussion, it's a good ingredient. Now we go back to the programs and how data can inform programs. I would like us to share the video that we have with Suna. It's just a few minutes, 3 or 4 minutes maximum, just to see how actually the father's program has been informed and what it led, actually, the data that has been collected. So let us see the second part of her contribution.
Hello, everyone. So we've also been collecting data at ACEV in terms of the father support program's impact, to see what kind of impact does the father support program have. Because originally we had devised this program back in 1996 as an early childhood development program. And we were very happy to find out through support from UN Women, UNFPA, Bernard Van Neer, that supporting fathers in this program, their behavior towards their children and wives changed, including how much time they spent, what kind of quality time they spent, whether they were refraining from physical punishment or not, were they being more tolerant. And so all these, in those areas that I've listed, there was positive and significantly positive change. They were able to have more constructive engagement and dialogue with their spouses. Substantial qualitative surveys also showed improved relations between husband and spouse. Some quantitative findings also revealed that there was the greatest change had occurred in promoting non-authoritarian attitudes in fathers. Now, when let me again share a few slides with you here. So we've understood that a long-term program where fathers come every week, and it's the closed group, where the group dynamic really plays a very, very important role. It's almost one of the main secret sauce of the program implementation. Now, another thing that this kind of data that helped us to understand was what kind of impact we're still trying to gain and bring out with children. And when we saw that the data, both the quantitative and the qualitative data, showed us that the 2-generation aspect of the program, combining the needs of children and parents with structured content adapted to the needs of both fathers and the children, were proven to be even more important. Hence, in the last few years, we've gone back and revised the program content so that there is more specific content, as you can see in this slide, for fathers to be able to take home to their children and be able to do little activities with their children at home. I guess as I'm ending, I would like to say that our biggest goal in doing this kind of data collection, be it program impact or be it more nationally representative descriptive research, trying to understand the state of fatherhood. Our goal is to take the journey that ACEV has been on for strengthening fatherhood skills and make sure it evolves into a societal discussion around what is shared care. We realized over the years that we can't just solely train fathers to impact fatherhood, impact father engagement in child development. To be able to do that, we really need a shift in fathers' attitudes on equal parenting. We have to advocate. And for that, we need data. And data really helps in this process to create advocates for change. The goal is to create champions. In the last couple of years, again, we've been working more partnering with the private sector to create champions there with our evidence-based advocacy. And I guess to be able to create a normative shift in society beyond programs and policies, we really need a strategy beyond just programming. Over the years, the Father Support Program trainers have become our champions. And as you can see, this is a few years ago on a Father's Day, where they've taken it to the streets. So thank you so much. These are some quick learnings and some quick sharings from ACEV's Father Support Programming. And we will be continuing to collect more data very soon. We hope to collect some now qualitative data, again, in partnership and leadership with Equimundo, to be able to really analyze and understand what their experiences are, men's and women's experiences are regarding shared care and men's engagement. Thank you.
And we thank Suna also. I think that was also kind of coming back into the picture of how data can be extremely useful, but data is data, indicators are indicators. And I think that they bring two different perspectives. And I think that's what we wanted to also underscore. In order for us to influence policies or to go to actually make fatherhood part of the quality monitoring of programs, that means influencing policy. So because what we have heard is that they are not necessarily named in either in the practices or in the policies or even in the data that is collected. So making them invisible, that shows that they are not part of the discourse about what means quality parenthood. And that's where actually I think our place is so important in building that narrative. With apologies for going a little bit over the time, I'm going to give now the floor to each of our colleagues that have been today in this kind of complex discussion to be continued. Do you think that coming back to the whole, or let's say, reflection over the discussions today, how relevant it is to have such indicators formulated, and if you have any top reflection on the discussion that we had today on how we can contribute to that? Who would like to have a final reflection? Please.
I can, if you want to go.
Okay, Clara, thank you.
To say that, yes, definitely, as we've been seeing, as you said, it's complex. Measuring indicators are super important to disaggregate by gender, by social class, by men, women, binary, non-binary, all individuals that can do the care. But I would say, of course, data alone, without investing in the infrastructure that is required, in the practices that will encourage fathers to not be invisible, to feel that they are speaking to them, right? That the messages, that the programming, that the content is eliciting, how positive and how important their role is in in the lives of their children, what a deep and long-lasting impact that can have. And so this means that the evidence programs such as ACHEVS or Program Peace or many others that have shown already to generate these positive involvement and of men in the lives of their children, that these programs become public policy, right? And that they are offered. And if we use the indicators to measure the types of involvement in health and early childhood that were proposed by Giorgio, that those are accompanied, of course, by the adequate training to those personnel and professionals, because it's not just inviting fathers to come. They won't come if the way that the messaging in the understanding of why they're not participating, why aren't they seen as that the invitation is really coming to them. If the workplace environments are not allowing for men to take time off in the same way that women, are more understood if they do to take care of their children. So basically to normalize men taking care of their young children in the same way that women, caregivers or mothers do. So again, yes to measuring, yes to indicators, but in order to see progress in those indicators, we need to invest in creating the systems, the laws, the policies, the culture, the normative change to support men really taking up that role and that care.
Thank you, Clara. It is a bit of a chicken and the egg, isn't it? So, yeah.
Oh, it's both. It's and. Yes.
Please, Jan, go ahead.
Yeah, I'm completely agree with Clara. I think she made a very good end of it. The only thing I wanted to say, and it's also referring to what Suna said, is maybe it's also interesting to have an indicator about the number of men involved in father groups, because I believe strongly in father groups, and okay, they can be organized digitally. And so I think it's important that we have also some figures about that, because I think it won't change because women have more a social group in which they can share their experiences with motherhood, and men they don't have, most of men don't have that. So it's important that we start with father groups. I believe strongly in it.
Thank you, Jan. I certainly, and I think Eberhard supports it even more. Yes, please go ahead, Eberhard.
Yes, thank you, Jan, for passing that ball to my side. Yes, fully agree. I think the biggest gap is between research, practice, and policy making. So let's close that gap between those spheres. And then thank you, Jan. As our work in the Father Center, our full approach is like bringing fathers together, sharing about their experience as fathers, informal learning. I can watch you, I can watch the other dad, how he takes care for his child, how he feeds him or her, how he soothes his child. And I can ask questions, and I can share my observations, and I can just give practical hints about best pediatrics, best playgrounds, best places to go. Yes, thank you. That's I think is very important as well. Thank you.
Thank you, Eberhard. And I'll give the floor, Manuela. Any closing thought before leaving?
Okay, yes. So I think that many of what have been discussed now are really steps that we need to do to have a more involvement, engagement of father. But I think that in that, one aspect that we have to underline is the importance not only the involvement of men as a father, but the involvement more broadly of men in care activity and in a profession that has to do with care. With that respect, what was said before Jan, I would
support very much. One important indicator would be in childcare, especially, but in early childhood educational care, and the number of men in the staff. So in teaching staff, educator staff, that would be really a big revolution, because we cannot only tackle the front of the individual father and the father in their daily life, but also in the profession that has to do with care. Thank you.
Thank you, Manuela. Giorgio, last but not least.
Well, we are, I think we feel encouraged in the work we have just started by your contributions and experience. And it's really a matter of chicken and egg. For example, the last comment by Manuela, you know, why we don't have male educators and teachers. There are two reasons. First, because males think it is not their matter, they are not interested. And second, because the salaries are very low. And we have to start from children very early in order to change this idea of what is males and females' role. And that's why we are talking about fathers, because only an early engagement of fathers can bring male children to start thinking in a different way about their roles. So it's not just about policies, it's about what we concretely do in the services every day. And the two things, policies and practice, must of course be combined to get the results. It's a difficult matter, but we are making progress. And Eberhard, I see hundreds of pediatricians every year, and I got a very positive figure about fathers participating to the first well-child visits, from less than 10% to over 30%. In some instances, even 50% are coming to the first well-child visits. This is within 10 years. And in Italy, I mean, but the overall picture is changing. And so since we started with a kind of pessimistic idea about the political weather in Europe, well, this is the civil weather, and maybe the civil weather is a little bit better than the political weather.
Well, I hope so, and I trust that we will persist in our endeavor to approach systemically. We are quite aware lots of the social norms that are to be tackled are difficult. It's a cultural change that requires a lot of time. But I think that if we are strategic and systemic and persistent, and we use all the levers that we have that are coming from practice, from research, and from policy implementation learning, I think that we will make, I hope, faster progress, because what I have heard that there is progress in place, but it's just too slow. We don't know if we can make it faster, but obviously all our efforts will be put into that. Well, I can only thank to all those that have stayed with us until the very end, with apologies for going beyond the time. But rest assured that we will share the recording of the webinar with all those that participated, and feel free again to share it with all those that are interested on the topic, because that's something that, again, is not just about us in the webinar, it's about a lot of stakeholders and being aligned in this endeavor. Huge thanks to all of you, and looking forward to continuing this discussion in other contexts and formats. Thank you again, and have a good rest of the day. Thank you. Goodbye, everyone.
Ciao, bye-bye.
Bye.
Thank you. Bye-bye.
A pleasure. Thank you, Michaela.
Same,
Have a good day, everyone.
likewise.
Thanks for
Thank you.
everybody who joined.